Hello, and welcome, or welcome back, to this ongoing series, Autism Spectrum Disorder in Three Dimensions. My name is James Coplan, MD, and I will be your guide to these materials. If you've been following along in real time, then you know I've been absent for the past week or two due to holiday travel and various related events. I hope this season has been a pleasant one for you. And if you're watching this on a delayed basis, then it really it doesn't matter. But in any case, I'm happy to be back. And we're going to pick up today where we left off our discussion of language and the problems with language that I feel are sufficiently important to warrant their own place at the table as a diagnostic criterion rather than being lumped in with social change as the current edition of the DSM would have it. The first area of language that we talked about, and this goes back a couple of posts, falls under the heading referred to technically as pragmatics. The word pragmatic is from the same root as the word practical. Somebody who's pragmatic wants to get the job done. And pragmatics, simply put, is the use of language to get things done, to communicate with other people in a way that's constructive and purposeful. And the best summary of impaired pragmatics was given to me by the exasperated mother of a 3-year-old on the spectrum when this mom said to me, "My child talks, but he doesn't communicate." And that really summed it up in the shortest possible sentence. But to get into it in more detail, the elements of pragmatics include reciprocity or conversational turn taking. At the moment, of course, I'm coming to you over the internet, so you and I can't interact directly, but after I make a point, I will pause for a few seconds, give you a chance to absorb it, nod your head, hopefully in agreement and understanding, and then I'll go on to the next bullet point as if you were right there in front of me. So reciprocity is a key element of pragmatic function. Conversational framing is a key element, and what this means is the speaker, before launching into a detailed narrative about a particular topic, will usually give the listener some idea of what's coming, of what it's going to be all about. For example, I went to the supermarket today, and do you know what I saw? So that kind of frames it and helps the other person to develop some expectation of what's coming next. Instead of, if I were to simply say, there were a whole bunch of apples on the floor. Well, what's he talking about? But if you know that I'm at the supermarket because I framed it out in advance, then you'll have some idea. Well, maybe the fruit bin was overturned at the store. Topic maintenance means just what it says, that when I raise a topic, you will respond most often, like in a tennis volley, by staying on the topic with me. Conversational repair, which we talked about in an earlier post, means when one person is confused, they'll say, I don't understand that. Can you go back and explain that again? Or maybe the speaker will say, gee, I'm not sure I said that quite right. Let me rephrase that. And there's a lot of that going on all the time. The only people who don't do that are the old-fashioned radio announcers who always had the perfectly turned phrase and the mellifluous voice and no hitches in what they had to say. And then response to changes in tone, pitch, and volume, which are called prosody. We'll talk about those in a second, as well as nonverbal cues like body language. So if I'm turning away and tapping my foot and rolling my eyes, you'll get the message that maybe I'm a little bit bored or turned off by what you have to say. And we'll get to that in more detail in a second. Impaired pragmatics, at its most profound, results in loss of any communicative intent. There's no desire or no apparent desire, as far as the outside person can tell, for any communication. A lot of persons on the autism spectrum, especially when very young or very profoundly impaired, may be nonverbal. or their speech may consist just of echolalia and delayed echolalia, and then later on, literal rigid language, and we'll talk about that in a moment. Off-topic responses, and that's exactly the opposite side of the coin from topic maintenance. And all of these things frequently taken together give rise to the impression that the person with spectrum disorder is talking at you rather than with you. Now, this does intersect with and overlap with impaired theory of mind skills, odd sense of humor, failure to appreciate verbal nuance. Part of that may be because the person on the spectrum has a hard time conceptually putting themselves in the other person's shoes. But part of it is also a linguistic issue, and we need to keep sight of that. And here's that quote that I was talking about before. My child talks, but he doesn't communicate. And I have always been profoundly affected by the things parents say that really express, in a nutshell, very complex concepts. And this is it in a nutshell for pragmatics. The second area that I think deserves emphasis is prosody. Prosody, Prosody, refers to things like tone, pitch, and volume. And you can change the meaning of a sentence by how you inflect it. You could say, come here, honey. Or you could say, come here, honey. Or you could say, come here, honey. And each one of those carries a different connotation. You can think of many other sentences, I'm sure, that depending on how you inflect it, you could say, I'm sorry, or I'm sorry. You know, one of them is sincere, the other is drenched in sarcasm. So prosody is essential as a layer of meaning. But imagine how it would be if you were unable to respond to prosodic cues or generate prosodic cues. And this is why the speech of people on the spectrum is often described as stilted, sing-song, robotic. It can sound pedantic. The volume can be overly loud, sometimes overly soft. And then there's this phrase that I made up, but it's really based on everything that George Frankl said in his 1943 paper that we went into in great depth on the post immediately prior to this one, which I put under the heading of nonverbal prosody. I've never seen that phrase used, but it's the analog in the nonverbal domain of verbal prosody. And this includes things like eye gaze, facial expression, manual gestures, body language, all of the things that I'm doing as I'm sitting here that you can't see at the moment, but those constitute nonverbal prosodic cues. Here's just the title page of Frankl's paper from 1943. And Frankl, in that paper, talked about what he called two symbol systems of language. First is what he called word language, i.e. language that's used to express, quote, thoughts that are raised to clear consciousness, by which he meant facts, commands, etc. And then the second type of language he called emotional language, which was used in his words to express moods, affects. Remember, affect is from the word, the same root as the word affectionate, so it means emotion. Moods, affects, and sentiments by means such as, quote, body gestures and the accentuation or the modulation of voice. And Frankl gets full credit for putting this on the table. Normally, Frankl said, word language and emotional language are integrated in the indivisible whole of human language. But there are certain conditions in which one or the other of these two symbol systems exists isolated, separated from its non-functional partner. And to illustrate that, he quoted one of his patients, Carl K. Now, as I mentioned last time, by the time Frankl wrote this paper in 1943, he had been in America for 5 years. But Carl K. was a patient that he had initially reported on back in Europe in 1933. And it remains a mystery to me why Frankl did not cite Donald Tripler or one of the other Triplet, I think, not Tripler, my apology, one of the other patients that he evaluated at Hopkins for Lee O'Connor. That's a mystery to me. In any case, Frankel mentions Carl K., who is a young man who, quote, even amid a crowd, behaved like a solitary person. He related to people in the same way that he related to objects. And he had, in Frankel's words, no communicative tendency. Quote, he did not send out any symbols of emotional language, even though he had some spoken words, a very small spoken vocabulary, but no symbols of emotional language, no gestures, no inflection, and he was insusceptible to the symbols of emotional language addressed to him. I assume that would mean no matter what tone of voice you used, it didn't seem to affect him. And I also shamelessly plugged this. This is the Early Language Milestone Scale, which I published in 1981, which by now is a very long time ago. You can see down at the bottom it says actually 1993, and the first edition was 1983. So not quite as far back as I was afraid, but still pretty far back there. And what we have on here is what I called auditory expressive, auditory receptive, and visual language. And in the visual language domain, we have things like responding to facial expressions, imitating gesture games, initiating gesture games, and pointing to desired objects. And then I made the point that if we compare in the auditory and the visual areas, we see that the age for emergence of the first word up here, my pointer is not working, is exactly the same as the age for emergence of index finger pointing down at the bottom. So again, George Frankl was absolutely right when he says that gestural communication is not simply a vestige of humankind before we had spoken language and we had to rely on grunting and pointing. In fact, gestural language is an integral part of our overall communication. And although it's a little off the topic for this blog series, any of you who are familiar with sign language for the deaf are fully aware that gestural language can be every bit as rich and fully featured as spoken language. Now, the third area that I'd like to cover, and one that we haven't really addressed explicitly prior till now, is rigidity of word usage. So people on the spectrum are rigid in lots of ways, and one of them is how they use words. Some words or sentences have more than one meaning. Often the intended meaning is context dependent, and we'll get to that in a second. But this is something that's very hard for people on the spectrum to get their heads around, that a word may mean one thing in one setting and a totally different thing in another setting. And failure to grasp the variability in the meaning of words can lead to odd word choices or difficulty understanding humor, sarcasm, figures of speech, implied meaning, etc. Lee O'Connor, in his paper, when he talks about his patient, quote, his patient number one, Donald, who was actually evaluated by George Frankl, although Frankl gets no credit in Connor's paper. Frankl did the initial clinical evaluation. Connor quotes the observation that there was one point in time when Donald's father was holding Donald on his shoulders, and Dad said, "Donald, do you want to get down?" And Donald did want to get down. But Donald said, "Do you want to get down?" as an echolalic phrase. But forever after that, the phrase, "Do you want to get down?" was the way Donald signified yes, because he seized on that phrase and it just stuck with him to mean yes. It meant yes in that one situation. And forever after that, that idiosyncratic phrase was Donald's way of saying yes to something. And then, last but by no means least, these odd word choices can be mistaken for rudeness by the unaware listener. So here are some examples. Here's an example of difficulty with figure of speech, but in a normal 30-month-old. And this was the wife of a good friend of mine when I was in the service. The mom said to her little girl, who was 2.5, "I have to fix dinner now." And the little girl said, "Dinner broken, Mommy?" She was not trying to be funny. She was just taking it literally, and she didn't realize that the word fix is context dependent, and in some settings it means to repair something, but in other settings it means to prepare something. Um, so in this case, this is a funny but perfectly normal example of a child who's having difficulty with rigidity of word usage. Now here's a phrase, "The chicken is ready to eat." What does that mean? It's context dependent. This chicken on the left is ready to eat. This chicken on the right is also ready to eat, right? It can mean two different things. Now, you may shrug your shoulders and say, "What's this all about? This is silly. This is obvious." But to somebody on the spectrum, this sort of thing is not silly and not obvious and can lead to all kinds of problems, especially when the listener doesn't understand that the speaker with a spectrum disorder may be having real linguistic difficulty. Here's a task that I would give to children in the office all the time. Draw a picture of your family. Here's the response of a typical 4-year-old. Draw a picture of your family. Now, for children slightly older who can handle a more complex command, I would say, draw a picture of your family with everybody in the picture doing something. And that's a marvelous way of getting a child's point of view as to what's going on in the family, as well as learning a whole lot about the child's cognitive and emotional processing, as well as their graphomotor skills. So here's an example. Draw a picture of your family with everybody in the picture doing something. And this is the result produced by a patient of mine who was 8 years old at the time with high functioning autism, or what we might call Asperger syndrome, hyperverbal, high verbal IQ, but rigid, socially odd, intrusive, difficulty with subtleties of meaning. And here's his answer. He says, and I put the black arrow on here. He did not do that. I added that, which is a good thing I did because my pointer is still not working. He said, "I'm building the Titanic. It looks like the Lusitania. The Lusitania sank by getting hit by a torpedo in 1918. My sister is making a video of herself on her iPad mini. My dog is chewing on a toy. Mom is going shopping. And Dad is checking how much money he has for Mom." So this is a very rich, descriptive narration. He has his fascination with the Lusitania, which you can see that he's drawn, and his picture is drawing a picture of herself on the iPad mini. So this child actually has some pretty good theory of mind skills, some representational skills, but his language is still notable for his little monologue about the Titanic, but he gets the message of what I want, and he draws a picture of his family, which is what I wanted. In a minute, I'll contrast this with a child who is significantly more impaired. But before I do, let's talk about literal language. So here's a little picture card, and these were in a little spiral-bound notebook, and the child's task was to identify them and then to answer some simple WH questions, who, what, when, where, and why questions. So initially I would say, "What is this?" And the child is supposed to say, or typically would say, "A tree." And then I would say, "Who lives in a tree?" And the child would say, "Birds, squirrels, etc." So I had a child, high functioning, on the spectrum, and I said to him, "Who lives in a tree?" And he answers me like this: "Nobody lives in a tree." Now, I know he's on the spectrum. I know he's not just being lippy. And I know what the problem is linguistically. This is not a theory of mind problem. This is not a social affective problem. This is a linguistic problem. Problem with rigid word usage. So I say to him, "What animals live in a tree?" Because I know I have to ask the question exactly the right way in order for him to answer in the expected way. And once I ask it in exactly the right way, his problem goes away. And he says to me, birds, squirrels, etc. So here's an example, a perfect example of where a linguistic problem, rather than a theory of mind, social skills problem, is what's tripping the child up. Now let's get back to that picture drawing task with the family. So I have a patient who's significantly more impaired than the child I showed you before. So I say to him, draw a picture of your family. And then to give him a prompt, because I'm not sure he knows what I mean, I say, Mommy, Daddy, Riley, you. Though Riley being the name of his sister. And this is what he does. A piece of paper that he prints, Mommy, Daddy, Riley, you. He took me literally. The initial comment, draw a picture of your family, went sailing right over his head. And then when I said, Mommy, Daddy, Riley, you, he writes, Mommy, Daddy, Riley, you on the piece of paper. Now imagine that it's your child who's on the spectrum and he's in first grade. And your child's teacher gives some kind of instruction and your child gives a response that's kind of tangential. In other words, not what the teacher wanted, but your child's best effort. But the teacher doesn't get it. Your child is going to get slapped down for being rude and disrespectful and non-compliant, because I've seen those things happen. I've seen those kinds of reports come in from the school, and the teacher just simply doesn't get it because they don't understand what's going on. So here's another child, 5.5 years old, verbal IQ 146. And I say to him, which is bigger, 9 or 6? And he answers me, they are both the same size, but 9 has a loop at the top and 6 has a loop at the bottom. Again, you don't have to have a very strong power of imagination to realize that if this kid gave this answer to the teacher in school, he'd be on his way to the vice principal's office as a discipline problem, when it's not a discipline problem. But look, he's bright. You know, kids like this typically aren't getting any services because they pass all the written readiness tests with flying colors, but they slip on the banana peel. And again, this is not a problem with social skills. This is not a theory of mind problem. This is a linguistic problem, and that's why language needs to be reinstated as a diagnostic criterion. So here we have the slide that you've seen before, and on the far left we have the most severe verbal, rather speech and language problems, no verbal communication, and no gestures or body language, or severely impaired. And then we progress to some functional communication, which may be hand over hand, signing, which is a vastly underutilized resource, I'm afraid, and that's a talk for another day. Picture exchange, which are flashcards, stock phrases, echolalia in context, but continued abnormal prosody, and then good functional communication, but persistent difficulty with theory of mind tasks such as humor or sarcasm, as well as rigidity of word usage. Now, here's what I was talking about with the hypothetical child who says the 9 and the 6 are the same, except the 9 has the loop on the top and the 6 has a loop on the bottom, or who says nobody lives in a tree. And the teacher, if they're not attuned to the child with high functioning spectrum disorder, who may not be sitting there with flapping and spinning, and whose eye contact may be fairly good, and who speaks in sentences, who doesn't have echolalia, but still has profound difficulties linguistically, that teacher is going to perceive the child as disrespectful, non-compliant, unmotivated, stubborn, aggressive, disruptive, impulsive, inattentive, could do better if he only tried harder. And I've seen all of these things on school reports, as well as task avoidant. And we'll get to that when we talk about cognitive rigidity, which is the criterion coming right after language. But if you don't see what's going on, you're going to see the two faces like this. But if you see what's going on, you see the vase. You know, this is do you see the two faces looking at one another, or do you see the vase? And if you understand that this is a kid who may be on the spectrum, because as a teacher, you're not empowered to diagnose, but if you've been around a long time, you have an eye for it. Socially impaired, linguistically impaired, rigid, anxious, perfectionistic, and so on. And this is where I've seen so many kids referred to me because their language issues are the banana peel, and they're getting sent to the teacher as having a discipline problem. Well, that about wraps it up for this post. For those of you who have been following this series in real time, I apologize again for the uh, hiatus between the last post and today's post. The holidays intervened, plus a little touch of the flu, but I'm happy to be back, and I look forward to continuing this series next week. And next week, we're going to move on to discuss what I consider to be the third major element in the clinical picture of spectrum disorder, which is to say, cognitive rigidity. So I look forward to seeing you in another week. Thank you.